1. Which of the following would most likely result in denial of ARRT certification eligibility? A. Failure of a state licensure exam. B. A single speeding ticket. C. A felony conviction for fraud. D. Termination from a previous job. 2. What must a candidate report on the ARRT ethics review pre-application? A. Only criminal felonies. B. Any honor code violations. C. Only convictions within 5 years. D. Only academic infractions. 3. Which document outlines the professional behavior expected of ARRT certified individuals? A. Code of Federal Regulations. B. Code of Medical Ethics. C. ARRT Standards of Ethics. D. Joint Commission Guidelines. 4. What is the consequence of knowingly submitting false information to the ARRT? A. Suspension for 30 days. B. Immediate revocation of eligibility. C. Fine only. D. Requirement to retake the exam. 5. How often must registered technologists reaffirm their compliance with ARRT's ethics requirements? A. Every 2 years. B. Annually. C. Every 10 years. D. Only upon certification. 6. To be eligible for ARRT certification in radiography, a candidate must have completed an accredited program within how many years prior to application? A. 1 year. B. 3 years. C. 5 years. D. 10 years. 7. What type of examination format is used in the ARRT radiography certification exam? A. Essay. B. Oral. C. Computer-based multiple choice. D. Paper-based short answer. 8. How many attempts at passing the primary ARRT certification exam are allowed within 3 years? A. 2. B. 3. C. 4. D. 5. 9. Which of the following is not a primary pathway ARRT certification option? A. Radiography. B. Sonography. C. Magnetic resonance imaging MRI. D. Computed tomography CT. 10. What is the minimum passing scaled score for an ARRT primary certification exam? A. 65. B. 70. C. 75. D. 80. 11. In the ARRT radiography exam, which content category includes topics like X-ray interactions and image quality? A. Radiation protection. B. Image production. C. Procedures. D. Patient care. 12. Which category includes patient positioning and radiographic procedures? A. Image production. B. Equipment operation. C. Procedures. D. Patient care. 13. What does ALARA stand for in radiation protection? A. As low as reasonably achievable. B. All limits are radially accurate. C. All licensing authorities radiate appropriately. D. Accurate levels are radiologically aligned. 14. Which factor primarily affects radiographic contrast? A. MOS. B. SID. C. KVP. D. OID. 15. Which of the following is considered part of standard precautions in patient care? A. Isolation of all patients. B. Wearing gloves for any patient contact. C. Hand hygiene before and after contact. D. Full PPE for all interactions. 16. How many continuing education CE credits are required every 2 years to maintain ARRT certification? A. 12. B. 24. C. 36. D. 48. 17. Which of the following qualifies as an approved continuing education activity? A. Watching a medical drama series. B. Completing a CE course approved by a recognized RCEM. C. Attending a hospital staff meeting. D. Reading a medical blog. 18. What happens if a technologist fails to meet CE requirements? A. Permanent revocation of certification. B. 6-month probation period. C. Loss of ARRT registration. D. Fine is issued. 19. How often must ARRT certified individuals renew their registration? A. Every 6 months. B. Every year. C. Every 2 years. D. Every 3 years. 20. What is the purpose of ARRT's continuing qualification requirements CQR? A. To verify license renewal. B. To enforce mandatory state testing. C. To assess and maintain qualifications every 10 years. D. To allow specialization in other modalities. 21. Which of the following is a requirement for post-primary certification in CT or MRI? A. High school diploma. B. Completion of 1,000 supervised procedures. C. ARRT primary certification. D. No previous experience required. 22. Which post-primary pathway involves the use of radioactive materials for imaging? A. CT. B. MRI. C. Sonography. D. Nuclear medicine technology. 23. The ARRT structured education requirement for post-primary eligibility must be completed within how many years of application? A. 1 year. B. 2 years. C. 3 years. D. 5 years. 24. Which credential is awarded after passing the ARRT MRI post-primary exam? A. MRIC. B. RMRTC. RT. Mr. D. MRT. 25. How many clinical experience procedures are required for post-primary MRI certification? A. 25. B. 50. C. 100. D. Varies by procedure list. American Registry of Radiologic Technologists certification. The American Registry of Radiologic Technologists ARRT certification exam is a comprehensive computer-based test designed to assess the knowledge and skills required for entry-level radiologic technologists. It evaluates a candidate's competence in key areas such as patient care, safety, image production, and radiologic procedures. The exam is typically taken after completing an accredited educational program and meeting ARRT's ethics and clinical experience requirements. With a scaled passing score of 75, the test ensures that certified professionals are prepared to deliver high-quality diagnostic imaging services. The ARRT certification is recognized nationwide and is a critical credential for licensure and employment in medical imaging fields. Here are the top 5 beneficial uses of the sample exam. 1. Credentialing for employment. ARRT certification serves as a nationally recognized credential that validates a technologist's qualifications, making them more competitive in the job market. 2. State licensure requirements. Many U.S. states use the ARRT certification exam as part of their licensing process, streamlining compliance and legal eligibility to practice. 3. Professional credibility and trust. Certification demonstrates a commitment to high ethical and clinical standards, enhancing trust among employers, patients, and healthcare teams. 4. Career advancement. ARRT certified professionals are often preferred for promotions and leadership roles within radiology departments and healthcare facilities. 5. Eligibility for post-primary credentials. Passing the ARRT exam opens the door to advanced certifications in specialized imaging modalities such as CT, MRI, or mammography.